conference is also being recorded. If you have any objections, please disconnect at this time. And now I'll turn the call over to your host, Ms. Karima Hunter. Ma'am, you may begin.
Hi, thank you so much. Hi all, my name is Karima Hunter, Master of Public Health, Master of Applied Data Science. I am your program manager for the Shepard IDIQ. I'm going to go over just a little bit about Adobe Connect and our platform we're using today, and then some ground rules for asking questions, and then we'll just jump right in. So you should have available to you a Q&A box. You can put your questions. We ask that those questions be relevant to the slides that are being presented, so they're content questions. In the chat section, you can put any of your IT questions, or you can't hear, the audio is bad, please repeat yourself. So any process or technical questions you want to put in the chat, all other questions will go in the Q&A. When you ask a question, please put your org name first before your question. We will be taking questions, Q&A, right after the overview presentation, and then we'll have a presentation specifically about Domain 3, and we'll have a question at that time as well. You can ask the questions whenever you like. It doesn't have to be in order, but it would help if you'd ask the questions based on the slides that are being presented. We will be going through the questions and answering those that we can respond to easily. Those that may require us to go back and get further information or to touch base with our Office of Acquisition Services, we will follow up, and I will give a response to your Q&A, or whether or not it will be answered live, or whether or not it will be answered during the Q&A follow-up. Everyone will be provided the link to this presentation, to the video for this presentation after it's over, or sometime after it's over. I don't know if we will have the slides available, but I will let you know. There are a varied amount of people in the audience today from different types of vendors and contractors, some familiar with Shepard, possibly some who are not. Because this is a brand new domain, we don't have anyone who's been awarded in it before. I'm pretty sure there are going to be a lot of questions, and so do not hesitate to ask your questions. That's all that I have. Are there any technical or IT issues? Can you hear me well? And otherwise, I will start. Debbie Downing also will be here to help with technical assistance. She just put a note into the chat. Okay. Shepard stands for Safe Healthcare Epidemiology, Prevention, and Research Development. We will talk about why CDC started the Shepard program. We'll give you a slight overview of our current iteration, 5-year iteration, which started in 2016. We will talk to you about the next steps for the recompete, which the activities for the recompete will be in 2020 for the 2021 cycle. We'll talk about a new domain structure that we have for the new RFP. And then we'll discuss a little bit about the request for proposal timeline and process. We will talk very briefly about the differences between contracts and cooperative agreements, but more so about small business and small business set-aside and primes and subs. And then I'll talk to you about some recommendations for your application or proposal. So why did CDC start the Shepard program? Initially, of course, we are in a division of healthcare quality promotion, so we wanted to prevent healthcare-associated infections and antimicrobial resistance as a priority for our division and for CDC wide. CDC seeks to work collaboratively with outside partners. However, Various expertise is needed across the research spectrum, from pilot studies to multi-center implementation to guidance development. We can't always work collaboratively with the structures that we have in contracting. So prior to Shepard, extramural research related to HAIs was funded through grants and cooperative agreements. And while these funding mechanisms are extremely valuable, there were limits to, from a public health perspective. The precise research questions are usually driven by the external researchers and not the CDC research priorities. The timeline for the project conception to award is typically slower for a cooperative agreement and a grant than it is for a contract. And that time period is relative. Contracts still take time, but we found that we were able to award contracts a little bit more rapidly than cooperative agreements. So that's how we created the Shepard program. It's basically a program to work with our external partners on a contractual basis to perform research and other innovative activities related to the prevention of HAI and microbial resistance and healthcare quality. This mechanism allows CDC to very specifically define the research and innovation task, and like I said, can be awarded relatively quickly. The ceilings for the Shepard program in 2011, we only had 1 domain and 12 vendors. Our ceiling was $100 million. In 2016, we had 36 vendors with 45, I think, separate awards because they could be awarded in multiple domains, and the ceiling was $200 million. For this new iteration, we have 5 domains, and the ceiling will be somewhere between 90 and 100 million, and I'll explain to you why. We have other mechanisms at CDC, so I don't want anyone to get their wires crossed about exactly what Shepard is and what it isn't. If you're an academic research center, you might have heard about or applied to our broad agency agreements via white paper. You may have applied to a cooperative agreement out of our division or others. We do also do sole source contracts when there's only one vendor who has the qualifications to meet our requirements. And then we also do interagency agreements with other government agencies like the VA. I do want you to know that if you see other opportunities out there and you're wondering what's actually going to be under Shepard and what actually is going to be under one of these mechanisms, just know that DHQP monitors all these mechanisms to ensure that there is no duplication of effort. So let's talk about this cycle coming up. An indefinite duration, indefinite quantity contract allows us to make an initial offering to vendors to participate in the program. So you'll be awarded the opportunity to exclusively compete on task orders for the next 5 years. Vendors provide an indefinite quantity of services during a fixed period of time. During the 5-year cycle, CDC will offer any number of opportunities to compete for contractual awards, and only those vendors who are part of the program are allowed to compete. Like I said, the current cycle has 36 vendors representing 36 different organizations, but then we have 42 individual awards. Some of these vendors are academic, some are healthcare delivery, and some are non-academic research vendors. The current cycle ends in September 30th of 2021. If you are a current vendor, I will note that new contracts can be awarded in 2021. The fiscal year starts October 1. So new contracts can be awarded, but no options can be awarded from that 2016 vehicle after September 30 of 2021, which means that the base contract can be 1, 5, 6 years, but no options on that contract can be awarded. So what did we change? In some of our advertisement and promotion for this webinar, we did send out a link to the 2016 RFP, and so if you had a chance to look at that, you saw that we had 8 domains. Since then, we have removed domains 3, 4, 6, and 8. Those domains are the long-term acute care, long-term care quality improvement and research implementation infrastructure, the dialysis domain, which didn't have anybody awarded in it anyway, and then what we call the lab domain, but it's the advanced molecular epidemiology or microbial community analysis domain. And then also we had a veterinary domain where we did One Health work, and that will be eliminated in this next iteration. We did expand domain 1 and 2, and then of course we added this new domain 3, and I'll talk to you about those expansions. So in domain 1 and 2, specifically in domain 1, we put the advanced molecular epidemiology as a preference for domain 1 vendors. We acknowledge that some of these lab capabilities maybe weren't as prevalent in 2016, and many of our academic research centers do have access to these capabilities now. So that's a preference, it's not a requirement. In domain 2, we put together all the healthcare facilities. So before we had a separation between acute care, long-term care, and dialysis centers. Now it's all together, and it is a preference for vendors in that domain to own, operate, or directly influence the decisions at those facilities. So not through a normal MOU or memo of understanding. They actually have to have some ability to make decisions for those facilities. And then we'll talk more in depth now about the new domain, domain 3, which is entitled Formative Research, Guidance Development, and Translation to Improve Healthcare Practices. Some currently awarded Shepard projects. I'm not going to read through these, but we have a number, and Shepard is available CDC-wide. So you won't just get DHQP or the Division of Healthcare Quality Promotion projects. You won't just get NCEZID projects. You'll get projects from across the agency that have to do with healthcare epidemiology research. In Domain 5, we have a number of vendors for EHR, and we've done a couple of projects in country and out of country. So the IDIQ is open to task orders for international work as well. And so Domain 7 is our international domain, but we do international work as it relates to other domains. What determines whether a project can go from one domain or the other is whether the majority of work is relevant for that domain scope. So I'll talk a little bit more about next steps. Just look at the Q&A, make sure everybody's okay. So our main funding in 2016 came as a response to the National Strategy for Combating Antibiotic-Resistant Bacteria, or the CARB goals for the U.S. government. The major ones here are listed. Since then, we do use a lot of AR funding, and if you want to know more about our research agenda at DHQP, you will want to look at the 2019 Antibiotic Threat Report. Here's a copy of the front cover of that report and where it can be found. Within this report, it really just outlines, amongst other things, rising resistant infections in the community, and it also lists 18 AR bacteria and fungi into 3 categories based on their level of concern to human health, both urgent, serious, and concerning. But during the Domain 3 presentation, we will talk about some potential projects as they relate specifically to Domain 3. So for 2021 through 2026, our goals will be to continue to provide the agency with a resource for healthcare epi and infection control research task orders. These task orders go out as rooftops, and that stands for Request for Task Order Proposal. The funding of task orders is going to focus on healthcare epidemiology prevention research, implementation, evaluation, surveillance, and medication safety studies. We want to identify the vendors who are best suited to perform the Focus and Apply HEI prevention research studies and other innovative public health prevention efforts related to healthcare epi. So a little bit more about the new domains, the new domain structure. These are the titles of which, and I'll just read the scope, the main scope of each domain. So for domain 1, the scope really remains unchanged other than that preference for the lab capacity. So we're looking for experienced research organizations with the capacity to develop and implement research concepts and protocols. And domain 2, like I said, we merged together the multiple healthcare settings. In that domain, we're looking for vendors who can implement single and multi-center quality improvement and or research projects in large networks of healthcare facilities that include both acute, long-term care, skilled nursing facility, dialysis center, and other outpatient facilities. So in domain 3, what we're looking for, and this is just going to be a brief overview, and Michael Craig will take us more in depth. We will be looking for vendors who can evaluate, enhance, and disseminate products that assist in improving healthcare practices and bridging the public health and healthcare divide. These services will and should be uniquely informed by the perspectives of the product users. And so it will have to include the expertise of patient advocates, healthcare professional societies, and public health experts across the healthcare system. Our international domain remains pretty much unchanged, and so does the healthcare IT domain. And the international domain, we're looking for vendors who can provide access to clinical infrastructures in low or middle income countries as defined by the World Health Organization within single or multi-center research study protocols can be implemented. In domain 5, we're looking for vendors of proprietary electronic healthcare record systems or other healthcare information technology products and services. So what does the timeline look like? This process actually is a 2-year process. We have been working for a while just to develop the RFP, make these changes in a collaborative way across CDC and within our division. And now we're at the point where in October you should receive a request for proposals. The proposal time will be 90 days, roughly. So if the RFP gets out October 1, it'll probably be due sometime before December Christmas holiday. If you are ineligible, you will know by the following June. And it really does take that long for us to go through the process of reviewing a number of applicants each domain. So it is a competitive process, and only the best vendors will be awarded. The notification of awards will be by September 2021. So just in case you don't know, some of you heard about this webinar opportunity from Beta SAMS, but if you don't know, FedBiz Ops is now Beta SAMS. The solicitation will only be posted on Beta SAMS. So you need to ensure you're receiving notifications for the right NACI codes. So the solicitation will be put out and we'll have a list of eligible NACI codes. That doesn't mean that those are the only organizations that can apply, but if you have it set up where it notifies you, it's going to notify you by NACI code. The submittal is not through Beta SAMS. That's major. It is not through Beta SAMS. It's going to be by email and by mail. So you need to follow the instructions in the RFP to a T. Hard copies are a requirement, and they usually come in a binder. You usually have to put together a binder. The post date must be before the deadline, which means you don't have to receive the hard copies by the deadline, but they have to be post-dated by the deadline. The electronic copies, however, do need to actually be received in our inbox by the deadline. The usual problem that we have here is that CDC has a firewall. So you can send something one day and we won't get it for 48 hours. So, and that will count against you. So I would say whatever the deadline is, back that up by a couple of days and make sure we receive it by then. The solicitation will have 2 main parts. The first part, you provide documentation of your experience and capacity to participate in the overall Shepard program. Like I said before, it's competitive, and we want the most eligible people. The second part will be a response to a request for task order proposal. This may or may not be a sample. We may award this, but this is just a demonstration that you can perform the specific tasks that are outlined in that task order proposal. Applicants will be evaluated and scored on both the capacity for participation in the overall program and on response to that rooftop. And the breakdown of the scoring will all be included in the RFP. The rooftop and the solicitation, like I said, may only be a sample, but we may award it as well. And you'll know that on September 2021. Some of the major application changes, if you did get a chance to look at our 2016 RFP, it's a beast, for a lack of a better term. It required a lot, and we've slimmed down a lot of those requirements to kind of help out during these COVID times where a lot of our PIs and our vendors really just don't have as much capacity to respond and apply. So you can apply. Before, you had to apply for each domain individually, which meant a separate binder for each domain. You don't have to do that anymore. You can apply for all domains in one application. The initial page limit for the proposal, which is like just the meat of your application, doesn't include resumes, doesn't include supporting materials, will be 10 pages. You will get an additional 2 pages for each additional domain that you would like to apply for. And the max of which is 18 pages. There will be no mandatory minimum requirement. Before, we had 2 pages where you had to just justify that you are eligible, and we wouldn't even look at your application unless you met the eligibility requirements. We have an Office of Acquisition Services. They were the ones who looked over those requirements, and we didn't even see an application unless they approved. So this time, the program will actually be ones making a determination about who meets the requirement. For example, when the vendor applies maybe, I guess, for 3 different domains, your max page allowance will be 14 pages. So we'll talk a little here just about small business and small businesses and the small business set aside. So, like any contract that we put out, and especially with this IDIQ, we did do market research. It was determined that part of this work would be eligible for small business, and because of that, we wanted to not just have the small businesses compete with all the other large businesses, but just to give them some incentive. So this domain has been identified as one that's suitable for small business. There will be a set-aside, which means all projects under the threshold of $250,000 will be set aside just for small businesses. So, and any vendor who is in this domain, 25% of the work must be for small businesses, which means if you are a prime, you most likely will have a small business sub. The indirect cap is 10% when subcontracting for small businesses. We don't want to pay twice as much as the project is worth just in indirects. We really want most of that money to go to the small businesses for them to do the work that we need them to do. We do realize that applying for something this large, there's a lot of requirements. There are a lot of clauses that you have to meet. There are small business resources, and I would urge you to access these as soon as possible. Some things take a few months to set in order to be eligible. These links are here. I'll also actually put those in the chat box. So one link just says, do I qualify as a small business for government contracting purposes? If you are familiar with government contracting and the definition of small business, it's based on the NACI code. So based on one NACCE's code, you could have 10 employees and be considered a small business. And another NACCE code, you can have up to 1,000 and still be considered a small business. So you really won't know too much until we put out the RFP and you understand what the NACCE codes are. But this will help you in the interim. There also are contracting guides, there are contracting assistance programs, and there's counseling to help small businesses. I urge you to use these. We aren't using the raise hand feature, so if you can just go ahead and put your question in the Q&A box or in the chat if it's a process question. I only have a few more slides, so I'll get through it, and then I'll just open up for questions. So your prime and sub relationship. Subs need to be identified in the application, and a subcontracting plan is required. This is a more formal documentation than just an MOU. We want more. The chat or QA box. Okay. I do hear your message about the Q&A box, and so Debbie, if you can make sure everybody has access to the Q&A box and the chat. So this is a more formal documentation than an MOU. This subcontracting plan, within the subcontracting plan, we'll make sure that that 10% is not going just 10% cap for indirects. We'll want to look at their capability statements as well for your subs. So it's a little bit more formal, and we'll have a template that goes out with the RFP. Additional subs can be added after the award if the opportunity arises. But you can't say we want to work with such and such and have that considered as a basis for how you're evaluated. You will want to make connections with patient advocates and professional societies now. There probably is a very long process to adding a sub to your award, so I would start having those conversations now. And I have to just over a little bit. I'm going to reduce this just a little bit so I can see. So what are some recommendations for your proposal? I highly recommend you have someone with government contracting experience. It can be very nuanced to meet these different clauses, especially when it comes to the data rights clauses and everything that's in the RFP. Some things are negotiable, so you really want to have someone with contracting experience to help you navigate through that. Does that mean you have to get somebody outside to help you or a consultant and you might have to pay that cost? Maybe so. And hopefully it'll be worth it. We want to make sure that you ensure you meet all federal contracting requirements. Consider the domains for which you are highly qualified and will be the most competitive. I know if you already finished the application for Domain 3, it might not be much to you just to write 2 more pages for another domain. But just remember that really you're going up against the most highly qualified in each domain. You want to respond to every requirement for participation in the overall program and the rooftop. You want to follow instructions and ask questions. There will be a Q&A period after the RFP goes out. So during that Q&A period, not only will we be answering the questions, our Office of Acquisition Services will be answering the questions as well. After the RFP is out and after this Q&A section, we really won't have any other communication with us as program. It'll really just be all contractual and technical requirements from that point on, dealing with our Office of Acquisition Services. Most of all, you want to demonstrate a technical understanding of the requirements and your capability to perform. We would like you to be very succinct. We don't want to search for your qualifications. I know a lot of vendors have this pre-developed capacity statements and that they have for their organization, and they just include that into the proposal, and it's just pages and pages. That makes a search for whether or not you're qualified or not, and that really isn't probably the best strategy. So be very upfront what qualifies you for the domain that you are applying for. Pay attention to page limits. Don't ever overestimate your pricing because pricing does come into play. We will ask for 5-year loaded labor rate projections. And if you want to look that up or ask me later about what a loaded labor rate is, it just wraps up your staffing cost with overhead into a labor rate for each staffing category. And we want that projection not just for year one, we want it for each year of the IDIQ, which includes inflation or increase in maybe your organization's indirect rate over time. And so we really want that to be accurate because we will hold you to that when you respond to a task order if your loaded labor rates are that much higher than what your projections were. You want to provide resumes and CVs for your most qualified staff and subcontractors. And again, just please follow all the instructions. So that's all that I have for the overview. And so I'll start to take some of the questions. And so sorry that Q&A was not available earlier. Let me see if I can make this bigger. Everybody can see it. So, Jacina McGregor, and everybody, please remember to put your organization before your question. So at the start of your question, just type what org you're with. Just figured out that the Q&A box does not appear if you join the listen-only mode. Sorry about that, and I hope that Debbie is helping you figure that out. What NACCE's code will be assigned to Domain 3? This will be important in order for us to determine if we qualify as a small business on this domain. Yes, of course, it will be. We will let you know as soon as we know, as soon as we can. So each domain will have its own NACCE codes, and so we'll make sure that it's really, really hard to let you know before the RFP actually, but if we do know beforehand, we will definitely let you know. The next question from Grace is the same. When will you be posting the eligible NACCE codes on Beta SAMs? Charles Williams asks, can small businesses only prime Domain 3 or can they prime on any domain? Any domain is open to you, especially if you already have contact with the prime and you see that the work is relevant and that you are eligible. Reginald Swift from Rubik's asks for Domain 3 on small business participation. What are the expected demographics of set-asides you'd be looking for? We have not, whether it be HubZone, 8A, these are different types of small business. We haven't made a determination. I think in general we want to make sure that, number one, your small business relates to the domain of work and has some previous experience would be great. Other than that, we will not be making a distinction of whether or not they need to be HubZone or 8A or women-owned business or anything else. And I assume this other SDVO, SB, maybe that's veteran or disabled small business. Karen Vieira from MedWriters. Your question is, how do you recommend for small businesses that can execute on a task order on their own to meet other businesses submitting as primes? Will you be making the attendee list from today public? You want to know the attendee list so possibly you know who else is interested. Honestly, people, you don't have to be on this webinar to apply, so it would be really hard to say who you're up against for this work. But we will be making the video recording available, so I don't know if the video recording will have the list of participants or not. I think it's going to kind of be hard for a small business by yourself to compete against some of the larger vendors. I think it really will be. So you'll have to make the determination for your org or whether or not it's better to go as a sub or to go in yourself as a alone. If a small business receives an award on Domain 3, will they be allowed to compete for rooftops above $250,000, or are they limited to only bidding on task orders under $250,000? That's a great question. No, you won't be limited. It's just that if we do put out anything under $250,000, it will be limited to only small businesses. But as a small business, you're not limited. If you see something in that domain that you could apply for, then you apply for it. From the Joint Commission, we have a question. Do you have an expected approximate number of prime vendors you are looking toward awarding in the 2021 cycle? I say no. No, we don't. We want the most qualified people, and the more options we have, probably the better. So we don't have any predetermined cap on primes for any domain. Kim Brown asks, I would like to explore teaming arrangements. Is there a list of contractors or primes I can refer to? Can we apply as a small business but also subcontract with a prime? That one I'm going to chair. I'm going to chair that question and take that to our Office of Acquisition Services and see what they have to say, and also talk to our small business advocate for HHS. Are you going to share this slide deck? We will share the recording. Let me double check to make sure we can share the slide deck. Lise Wardlaw of Alley and Lee Contractors asks, when applying for government jobs for a small business, this is the process we have to go through. My business is new. Yes, there are certain things that your small business has to set up in order to be eligible for federal contracting. So I would definitely go to that SBA link, because depending on where you are, I won't be able to guide you. None of us here will be able to guide any subcontractor into what they need to have to be eligible. So I will send those links out, and hopefully they'll have some resources for you in your new business. Best of luck. That is all I have, all I see in the Q&A, and we're at 2:40. So if everybody's okay, I'm going to pass it over to Michael Craig. And
hey, Karima.
Hi.
Thanks so much. Really appreciate that. And welcome, everybody. I'm Michael Craig. I'm Senior Advisor for Antibiotic Resistance at CDC, and I'm taking over the next part of the presentation, and I'm giving a bit of a deeper dive into Domain 3, and happy to answer questions at the end of that presentation. I think actually at the end of my presentation, we're going to open it up for questions about not only what I presented on, but questions for additional technical questions that Karima might be able to answer as well. So I want to just kick it off by thanking everyone for joining today. I really appreciate your interest in this domain and in the Shepard mechanism overall. Want to highlight that at CDC we have a long history, especially in the Division of Healthcare Quality Promotion, where the Shepard mechanism sits, of working with healthcare providers, healthcare organizations, and patient advocates. And I think we've come a long way with that, and really appreciate all of the partnerships that we've had. These mechanisms that we're talking about today, especially this one, are ways that we see that we can actually deepen and further our relationship with those organizations, where we can work with them and partner with them in more direct ways, and actually provide them with some financial resources to help us better do our work, and really to help the country better make progress on a number of different fronts in the field of healthcare quality and healthcare epidemiology. So I want to just highlight for this domain, there are really three major areas. Karima noted these very briefly, and we're going to talk about them in a little more depth and then give you some examples of things that will fall under here. And happy to, again, answer questions as helpful as we can. So the three areas and specific activities and tasks that will fall under this domain as a new domain under Shepard are formative research, and we have defined some areas of this. I would just note that for all of these categories, they're not totally comprehensive. We're not listing out every conceivable thing that we might need over the next 5 years, but we're trying to give broad enough categories to give you a sense so that you can best apply, share your expertise, and share what you know in these areas. So formative research, and some of the examples that we give in the solicitation here are expert panels, focus groups, and research consultation. The second category is guidance development, and this could be for a variety of things. It could be to actually develop a guideline for a healthcare setting or for a different or for some specific category of quality improvement in a healthcare setting. It could be to help CDC inform guidance that we're going to be putting out. It could be helping to evaluate guidance that CDC has put out or that maybe someone else has put out that needs some further understanding or examination. And then the last category is research, translation, and training. And under this category, we have broad areas as well, fellowship programs, especially those that can bridge the healthcare public health divide, training, development, and feedback, and then educational materials development. And again, all of these areas are quite broad, and we are just sort of highlighting these things as areas and giving you some examples to help you gauge what we're looking for. And I'm going to go into providing a little more detail for these things with some of the potential examples or potential projects we might be interested in over the next 5 years to give you a better sense of it. The next slide, and some of the things that are important to highlight, Karima gave you sort of some big picture requirements for the Shepard domain and for the application. I will just want to reinforce and thank Karima for all of her work on this. Doing all of these things and following all of the requisite laws and regulations that we have as a federal agency putting out dollars is critically important. And so I really want you to take to heart what you heard from her and note that, you know, we have to take these things very seriously, the timing of when applications come in, the content of what is required. You really do need to make sure that you are completing everything to the T. In many cases, if we can't make exceptions, and just highlighting that for you, that, you know, if you are a minute late, you are by legal definition, according to the federal government, late and therefore can be disqualified. So I'm specifically highlighting here, in addition to the things that Karima noted, requirements for inclusion in this domain. So when you apply specifically for this domain, there are specific things that we would like to be able to see and to have you be able to document and justify to prove your expertise and experience, because we do want very qualified entities to be able to do this. And highlighting these come from the solicitation, and you can see them there. So provide access to and have established relationship with experts experienced in advocating for patients and or public health concerns. Provide access to a constituency of professional healthcare workers through a formalized society or membership. And then documented experience in 2 or more of these categories. And I do want to underline that. We are not looking for everyone to be able to do all of these things, but we are wanting to make sure that we have a cadre and a cohort of organizations that we can support that can do all of these things. So we want you to be able to demonstrate that you can do at least 2 of these, and there are some requirements for how you can document that, and I would refer you to the solicitation to sort of be able to provide more specifics on how you can justify that in your application and what we'll be looking for. So just highlighting qualitative research, formative research development and implementation, developing guidelines for healthcare workers or healthcare settings, guideline product project evaluation, developing research translation materials, and then development of fellowship training programs for healthcare professionals. So again, we want to see just 2 of those categories. You don't have to do all of them, but you do have to be able to document it and submit it to us. The other things that we would just note, the first bullet here is actually not a requirement, but it is a preference, and we'll take that into consideration accordingly. If you have access to or have an established relationship with state departments of health, given the fact that we are CDC and we work in collaboration with state departments of health for a lot of our work, this is an area that we think is important. And if you can do all of the things plus have this, it's something that I think we will take into important consideration, and there is some preference that we will give for that. Then also just noting here, as Karima highlighted thoroughly, and I think is an important aspect of this domain that I'm just going to reiterate, again, Karima is the expert here and can answer any of your questions on this, is that this is a domain specifically identified as one that is suitable for small businesses and has the requirements and the set-asides that have been talked about to date. So I want to just give, this slide is to sort of give a big picture sense of what we're looking for in the domain, and just to highlight really some of the capacities and the needs of potential vendors that we are seeking as the CDC to try and better accomplish our work. So I don't think any of these will come as a surprise to anyone. They're critically important to us and to be able to further our work, and they're in areas that we have seen, especially over the last few years, and we've heard from, in fact, some of you, that we need to do better at. And this solicitation is our opportunity to engage vendors to actually improve our capacity and our expertise at the agency to better accomplish our work. So expertise in engaging healthcare workers, engaging patients, particularly working with patients and family members impacted by healthcare-associated infections. Access to established platforms and communication channels to improve dissemination of information directly to healthcare workers, patients, and their family members. Ability to provide recommendations on ways to improve engagement with healthcare workers and with patients and their families. Experience representing healthcare and patient perspectives to state and federal committees and advisory groups. And expertise in bridging healthcare, public health, and patient perspectives. So I think you can hear a lot of the themes that we're really seeking in this domain. We want to, both have the expertise and the science to be able to put out great recommendations and make sure that they are scientifically sound, but we definitely want to be able to make sure that we can reach healthcare workers, patients, and family members, as that is also a critical aspect of our work, and making sure that we're doing all that we can to make sure people know what good quality practices need to happen in healthcare, and that they're taking those good quality practices up and protecting their patients, protecting themselves, protecting their family members as needed. And the last couple slides here is actually just talking through potential projects. So we're in no way sort of saying that these are definitely projects that we're going to post over the next 5 years, but these are sort of brainstormed ideas or things that have come up recently or over the past 5 years that we have seen, we would like to be able to do a project on X and Y, but we don't necessarily have a vendor or a financial relationship with someone who can best accomplish that. And this solicitation in this domain is intended to sort of fill that gap and bridge that gap so that we can better accomplish what we want to do. So the next couple slides actually cover potential projects that we have either brainstormed or things that have come up recently. So development of educational materials for healthcare workers, patients, and their family members. Support fellowship programs to bridge public health and healthcare understanding. Conduct targeted outreach at the local level to healthcare workers, patients, and their family members to improve dissemination of materials. Develop evidence-based guidelines or guidance documents to help ensure safe healthcare practices. Convene expert panels or focus groups to help inform CDC efforts to protect patients. And then going on to the next slide. pilot novel outreach strategies to improve knowledge and behaviors of patients and or their caregivers, create resources to enhance awareness and ability to capture patient stories in all 50 states, advise on integration of healthcare-related topics for school-age children, provide evaluation support for existing CDC materials and or materials developed for CDC and its partners, and provide health communications and social marketing expertise to inform CDC's national education campaigns or to improve state and local campaigns. So these, again, are just intended to give you a flavor of the types of projects that you might see. Again, we're not definitely saying that we're going to be able to do this, but again, it's supposed to just try to give you a sense and give you some direction of the areas of interest and the expertise that we are seeking as a federal agency working in this space. And that is actually the end of my presentation, so I will stop there for questions, and I think, Karima, we can actually take questions here on any of the topics or areas. Is that correct?
Yes, that's correct. And I see a couple came in after you started. So I'll just answer those really quickly. From the Joint Commission, can we share a list of primes for the 2016-2021 cycle? I don't have any problem doing that. That's public information, so I'll make sure that you get that list. Alicia Cole, following up on partnering, will you have a way for primes to subcontract patient advocates? We won't have a way to connect primes with subs or subs with primes. But what we can do, and what I was thinking about, is maybe if you have any objection to us sharing the registration list today, please put that in the Q&A or in the chat, or send that to Shepard IDIQ at cdc.gov. And if no one has a problem with it, then I'll share the registration list. I think that's about the extent that I can do to connect primes with subs and subs with primes. Another question, will there be another webinar to talk in detail about other domains? There was another webinar. It was June 30th, and we discussed all the domains but domain 3. I'm so sorry if you didn't know about that, but we can make that link to that recording available as well. Is it fair to say that Domain 3 will initially focus on acute care quality and safety, but may expand to other areas? That's a Michael question.
Thanks, Karima. I think at this point, I don't think that we would sort of say a narrow focus. We work on healthcare quality in acute care, but we also are doing more in dialysis, in long-term care, and in other care settings, including outpatient care settings. So I think this is really going to be driven by the needs that we face, which are, especially with the current pandemic, sometimes unpredictable. So I don't think we would sort of pigeonhole it to just acute care, but we are interested in of course, acute care given the severity of illnesses.
Thank you. Dominique Garcia for Battelle is a question, could you also provide the slides from the June 30th webinar, please? If I can share the slides, I will share the slides for both webinars. Also, can the slides, this is the same question, from the previous webinar be sent or posted to betasams.gov? So yes, I will follow up and make sure that we can share those slides, and if we can, we'll do. By email, most likely, not posted to BetaSams. We're open to any other questions. Does anybody want us to go back to any particular slide? Would that be helpful? Thomas Kim from Infectious Disease Society of America asked, sorry if I missed it, but how are potential projects determined? And is there a mechanism to provide input to CDC regarding those projects? Michael can talk more about how the actual projects are determined, and then I can answer the second part.
Thanks, Karima. So I would just say that, projects are generally determined for this or for other mechanisms based upon needs that we identify at the CDC. I mean, those needs can arise because of things that we identify through outbreak investigations or through looking at surveillance data. They can also arise because of challenges that we see or we hear from partners or patients about specific areas, and we need to do something about them. So I don't think there's really sort of one way that they come to us, but I think we are always open and trying to be responsive to the field and trying to make sure that we are doing all that we can to improve patient and healthcare quality. So there's not really a subscribed way to do it.
Yeah. And just to answer the second part about whether there's a mechanism to provide input, we try to have an open line of communication. Once you're awarded, we will have like an award webinar, and we'll talk about all the contacts for your contract specialist, and then us in program, we're considered contracting officer representatives. And so, yes, questions, comments, anything can be submitted to us throughout the 5-year duration of the IDIQ or submitted to OAS. Can you provide a brief overview of the health IT domain? I think Mary Days and Kim Dobson gave that presentation, and I think they did it best. So I can send you the link, and they talked about it in detail. I will say, just as an overview, that domain really does provide services for our surveillance, NHSN, National Healthcare Safety Network surveillance system, but it's not limited to it. And so the scope is written very specifically for that, but it's open to other IT projects. And so I'll send you that link. It's helpful. We have a question, can you provide a brief overview? Okay, we already answered that. ICF said, if you mentioned that international work can be placed in multiple domains, not just the dedicated international domain, will it be necessary to show international experience capabilities across all domains, including Domain 3? No, it won't be a requirement. International work is not an evaluation criteria for Domain 3. We're still open for other questions. So I just want to let you know, just as a follow-up, I understand the need to have the NACI codes in order to determine your eligibility, and I will follow up with all of the registered attendees as soon as I get an answer about sharing those. I will also follow up about sharing the slides themselves, but we'll provide a link for the video recording as soon as I can. I think I shared one more question above, but all of the questions from that have been listed here and those from the previous webinar will be in a big, gigantic follow-up Q&A document, and everybody will have access to that. And then also our Office of Acquisition Services will have a chance to respond to those questions. So if there are no more further questions, we can end. So I'll give it maybe one more minute. All right, hearing none. Oh, hold on. Can we have your email address for further questions? Of course. Let me see. For some reason, my ability to respond to questions is not enabled. But that email address is Shepard, IDIQ at cdc.gov. And it was also the email address listed on the flyer. I will be manning that email address, and so will Brooke Lapp. She is the one in our program, our program fellow, who put together this webinar and helped with all of the promotion. And so we want to thank her for her work and her help. Also, Tiffany Woodard is the overall core, and Carla Dewan is a core for Shepard, and they will be responding to that email. So thanks so much, everybody, for joining us. Thank you, Michael Craig, and everyone else who was able to join as a presenter.
Thanks all.